in Taiwan, there's one case, no? Okay, there are 3 dead because the what they call the chef do not clean the hand properly.
Oh.
Then there are a lot of E. coli, this bacteria go into the food, So the problem is not the salad. The problem how clean is the food, That's why for salad you have to clean, you have to wash, you have to clean the thing carefully, and the chef had to clean the hand very carefully, Sometimes after toilet they don't clean the hand properly, then there are a lot of this what they call this E. coli bacteria that's very harmful. Okay, and it happened in China also, and in Taiwan it's very serious. 3 people died, after eating the salad because then after they find that they have a very dirty chef, never clean himself properly. These are the thing. Also in China, also they are because Chinese also like Japanese, they like raw food, right? They like this raw food. Nothing wrong with raw food. By right, you see the raw fish, you're supposed to go for cold sterilization, -52, to kill the bacteria and this thing. But many they don't do that, Okay, that's why in China, the southern part in Japan, there's a lot of parasite problem, because they eat the raw food. But do not blame the raw food, At the end of the day, it's a cleanliness that counts. How clean is your food, Yeah.
And doctor, my next question was, like
Yeah.
you told, that we should not differentiate between Western medicines. So many times, what we see that if people, if the person is consuming Western medicine, he is getting some side effects. So is there some
No, the problem,
precautions to
yeah,
be
the
taken?
problem within Western medicine is 80% of them are poison. So when you're taking Western medicine, you're taking poison. We doesn't want to comment, but we have seen many sad cases. We have one DXM member, She is suffering from cancer, and he had been using our product for 15 years, The cancer is still there, but very active, and he always buy noodles for me, The kind of Sarawak noodles, okay. One day, someone suddenly called me that she passed away, because one doctor said that she must go for the
Chemotherapy.
Chemotherapy, and she died, after receiving the chemotherapy. If she discuss with us now, we will stop here. Because already 15 years now, what are you going to do for chemotherapy for what? And they said cancer is there. So what's the problem with when the cancer is there? All of us have cancer cells inside our body. Even you and me, we have cancer cell in our body. Okay, so cancer is not something that coming from outside. It's due to the internal problem, Then we did not come. So it's not due to the pathogen, everything, Okay, so when treating cancer, not necessarily the cancer cell will disappear, Sometimes it's in check and balance. For 10 years, 15 years, they still survive. So at the time when I go to this Philippines, there's one lady, very serious, Doctor told us she have 2 to 3 years to go. By the time I met him, he's already on the 5th or 6th years, But he is still on mega therapy. She told me she don't mind, to spend the money, on the mega therapy. Okay, and his cancer is still there, but he live a normal life. That lady, they did a very active life now. Okay, then he always bring me the kind of Sarawak noodles, a kind of local noodles. It's very, I like the noodle very much, Okay, and her passing away is very sad event, Sudden pass away, suddenly. Okay, because the doctor insisted she must go for therapy. In one treatment, died, So we are not against the Western medicine, but it overuse did cause a lot of problem. Anything go to extreme.
Exactly.
Even you drink water, drink a lot also cause. No, we are not against any medicine, whether Western or this thing, but we are against the wrong usage of medicine.
But the problem is, doctor, human mind wants to overdo things. If they like
cinnamon, the India, every day they put cinnamon. You're gonna also ginger. Everything also they put in ginger. Ginger also don't consume it long term. It destroy your heart now. Destroy your stomach.
Now we see in Shangalun ginger being used as medicine, But
yeah. But don't drink it for fun.
In India we have tons and tons of it. Like
no, many Indian they powder the ginger, then they always use it for fun. No. Ginger is a medicine. No, we drink it occasionally.
Occasionally it's good for
it's okay, but
when you feel low.
not every day,
No, but the effect of ginger, doctor, to be used when you are feeling low, and it's been amazing.
yeah.
Ah, I have seen that.
No, one time when I'm in Peru, no, I pass out, no. The first time in a meeting, no. Suddenly I doze off, no. Actually, it's not doze off, it's passing out.
Mhm.
Then they bring me out. The first time on the stage, no, I doze off, no. Then after that, I feel extremely sleepy, you know.
Mm.
And Budiman Salim, no, I was here, no, the fall down. Okay, this a thing. Something wrong with the air, no.
Oh, air.
Okay, something wrong with the air. Then after that, my metabolism very low, my blood pressure also very low, no. Okay, it is very funny now because myself hyper blood pressure. My blood pressure always very high, but the time very low, no. Okay, it's about 110, 100 like this, no. Then I feel dizzy, you know. Okay, then the time our Indian staff they have this ginger powder.
Mm.
Okay, so we get the ginger powder, plus the cassia, but the cinnamon.
Mm.
Okay, so I make into tea and drink. Then I recover back.
Mm.
So to boost the metabolism, cinnamon and ginger is good.
It's good. Yeah.
Yeah, but don't drink it for fun.
I think that's it. That's a good
And another education for Indian, you know, cut down the spices.
spices. Yeah, too much of
Bad for your heart and stomach.
stomach
That's
also.
why India have the highest rate of the cardiac formula. They blame obesity, you know. Nah. They also blame the food. Nothing wrong with Indian food. The only thing is that you put too much spices, that's a problem.
No, the problem with India is only overdoing
No,
things.
Indian the
worshipping
food are quite
things.
balanced.
Yeah,
See,
yeah,
when
yeah.
you take the biryani, you also take the yogurt, you know,
Yes,
to
yes.
balance it out, you know. Okay, but the problem is the spice.
Mm.
You look at Malaysia. Malaysia, our food are influenced by India. We also use spice, but the spice are very mildly used, no?
Mm.
Or biryani, you know, we use spice, but not so strong as the Indian biryani. So
Correct.
in Malaysian, you take our biryani, you have been taking it before. Okay, not so strong,
No, very, very subtle and
but it's
mild.
still tasty, you know. It's still
Very tasty.
So why should you put so much spices for what?
Correct.
So Indians should cut down the spice.
Doctor,
Otherwise, your
we
heart, your stomach will be impaired, you know.
yeah. Doctor,
Yeah,
one
any more
last question.
questions?
Yeah,
Yeah,
one
please.
last question from Manjunath, and then we can close.
Yeah, Manjunath, yeah.
Good morning, doctor.
Yeah, good morning, Manjunath.
Yeah, so my question is nowadays, whatever the problems like they are facing, like diabetic or any kind of illness, this because of their psychosomatic. Means whenever we are going to talk to them, or their being is very sad, or they are moody, and whatever we say, even they are not ready to listen, or they are not ready to change their lifestyle, even though a little bit. Like we say, at least to do meditation for 2 minutes, at least to understand or calm down yourself. But they are ready to take all the medicines, okay? And again, they are blaming, I'm not recovering, and I'm getting this pain or that pain, or this constipation, or blah blah blah, many things. So how to understand them? That is the biggest thing, because nowadays whatever we say, like our Ganoderma, it's even though emotionally also it works, but at least they have to give a little support. That is my point of view. So then how we can, because one thing is, in my family, my daddy always is like, whenever we go to talk, and he's very sad when we are even I want to give him more time, even I want to listen, but he's not ready to respond. He's always like he's, I don't know, even though he's enjoying that pain, but always he's again complaining, I'm having that pain. Even he is taking 360 RGL from every month, he's taking 360 RGL from 16 12 years. But I know even his parameters, everything is good, but still he's not satisfied.
Yeah,
So
that's right.
yeah,
It's
how
common,
to
very common.
handle this?
You see, you as a doctor, you know, you're just like the guru. You need to apply skillful mean, you know. You need to
Okay.
apply the skillful mean. For example, my grandma, you know, my grandma is very funny, you know. He do not believe in Chinese medicine. He
Okay.
believe in Western medicine, oh, my grandma.
Yeah.
So when we want to give him Geronima, she refused to take. Okay, so that my auntie, you know, okay, he make mix the Geronima into the drinks.
Okay.
Okay, and give it to her. Okay, so sometimes we want to apply, in one case, we want to apply medicine to a child. He refused to eat, you know. Okay, then we make a decoction into jelly.
Okay.
Okay, into jelly, put in some sugar, and the child like it very much. Okay, so you as a doctor, so you need to be patient, and you need to use a skillful mean. Okay, and slowly explain to them. Maybe one explanation, two explanation, a few explanation is necessary. Okay, sometimes people are very recalcitrant. They're very hard to accept this other thing, especially medicine. So we tell them your health is in your hand. We as a doctor, we can only suggest you. If you still keep on refusing, we cannot do anything. No, there are too many this kind of cases in a day. They are very stubborn. But you as a doctor, you should be patient. Do not quarrel with them. Do not yelling at them. Do not angry with them. This is always common. We always find many difficult things, and this is how you practice the Zen. And you practice the endurance, to endure it. Yeah. So this is a good practice for you to practice your Zen. So no need to worry. Keep on convincing them, and keep on giving them testimony.
Okay.
Testimony are very convincing. After they listen to many testimony, they sometimes they get confused. You still remember our 3-3-4 principle?
Yeah.
Okay, when you talk to 10 people, 3 people agree with us,
Yes.
and 3 people they are not agree with us,
Yeah.
and 4 people are sitting on the fence, half
Yeah.
believe, half not believe. What you do? You convince these 3 people believe in us first. So when they get good result, those 4 people on the fence also join us. Then we have 7 people. When 7 people get good result, these 3 hardcore also they join us. This is the way of life, There's nothing much we can do. Always be patient with you as a doctor. Always patient with your sick patient. This is like as a guru. You must be patient with your student. Yeah.
Okay,
I
doctor.
think that's all for today.
Yeah,
Yeah.
that's all for this.
Okay.
Thank you so much. See you
Yeah.
tomorrow. Bye-bye.
See you again.
Yeah, bye-bye.
See you again tomorrow. Yeah. Bye.
Bye-bye. That brings us to the end of another session of Shangalun. I'm not sure if you all have tried the tomato, the onion, not the onion, the egg in vinegar. If you have tried the egg in vinegar, maybe you can show that tomorrow to Dr. Lim. I have started doing it. I did it a little late, so it's going to take some time for it to show up. But tomorrow you will gather again to study the next 10 verses of the Shangalun. Till then, thank you so much. See you. Bye-bye.
You may know how to run a business. You may know how to lead teams. You may know how to manage projects and sell products. But have you ever wondered what it means about reality? Have you ever wondered who you really are? I guess not. Because we are so busy working in our lives that we never get the time to inquire about ourselves and what reality is as it is. If you are curious to know more about yourself and the world around you, I'm very happy to invite you to this masterclass on Soul this Sunday, 20th of June at 12:30 p.m. My name is Yogesh Lokhande and I will be offering this masterclass on seeing the big picture. Thanks.